Hello and welcome to Early Bird by Amerisleep. I'm Dr. Devon Hoffman, and today we're going over shoulder blade pain causes and treatments. We've done the research, so you don't have to. Now, if you haven't already, please do go check out the blog post by Mr. McKinnon and Dr. Santhi. They basically created a great comprehensive overview of what's going on with between the shoulder blade pain, treatments, some symptoms that you might be having, and overall how to deal with this very painful sensation that almost everyone has been plagued with from time to time. Now, this is a very common issue, and I'm very glad we're tackling it today because sleeping position and other aspects of posture can be crucial in order to fix this type of pain. And if it's not fixed, this can last years and almost decades for many patients that I see in the clinic who never got it addressed, and it only tends to get worse. Now, there's a lot of different diversity when it comes to the reason behind this sort of pain. Some of these can just be as simple as poor posture throughout the day. Some can be more serious, like a muscle strain, and some can require certain surgeries like a disc protrusion or some issue in the thoracic spine. The good news, most of these issues can be solved conservatively with just doing a simple blend of medication, proper stretching, exercise, and good amount of recovery for this area of the body, including not only the spine, but also the surrounding muscles between the spine and the shoulder blade. Starting off, over-the-counter medication of pain-relieving or inflammatory reducers can basically help reduce some of these early symptoms. They might not fix this issue long-term, but if you are in severe pain, check with your primary care provider to see if this might be a good option for you. Now, from a physical therapist perspective, we see this all the time in the clinic, and certain stretches and exercises that will be highlighted later can basically help you to not only stretch this area, but also to exercise the muscles surrounding to really help engage those muscles, make them stronger, and relieve that pain that you're feeling. Now, hot and cold therapy can be great for relieving some sort of pain. Hot tends to be for more muscle tension, helps to reduce a lot of the tightness that you might be feeling, while cold therapy can be great for inflammatory conditions and help to reduce a lot of the inflammation that might lie between the shoulder blades to help relieve some of the pain you're feeling. Now, the stretches and exercise I talked about earlier are going to focus primarily on activating the muscles between your shoulder blades as well as stretching them. There's a lot of different videos out there. Depending on what sort of shoulder pain issue you have would dictate which exercises and stretches you do. So it's very important to make sure you get a personalized treatment plan rather than following some sort of generalized routine that might be targeted toward this area. Now, preventing shoulder pain, this is where we can really help you guys make a lot of impact long term and making sure this issue doesn't stick around. The first thing to focus on is good posture. Now, this is a super prominent issue for all the desk workers out there that feel this sort of pain. Making sure you're getting up and moving those shoulder muscles and making sure that they're not being stagnant for a long time can help prevent pain. In addition, not overusing your muscles, repeatedly reaching overhead, working out too much without rest, etc. can be a great way to relieve or prevent this sort of shoulder pain from coming back. And lastly, making sure that you have proper sleeping position and a good mattress to support your body while you sleep is crucial in making sure that this shoulder pain does not come one day. Now we're going to dive into some frequently asked questions by you guys about how to prevent shoulder pain and some other aspects of pain that might be a little confusing. The first one going over is side sleeping a cause of shoulder pain, and should I avoid it? If you do have proper support and a proper mattress and good alignment, shoulder pain should not be there while you're side sleeping, and it can actually help prevent if you do sleep with that shoulder on the elevated side. Now, this is a very common issue for a lot of people that do have shoulder pain, so this is a very good question, but if you do have proper support, I wouldn't worry about it. Why do I get knots specifically in the shoulder blade? Now, this is a very good question, but basically this region of the thoracic spine tends to be where we arch over to lean forward, a very common area to get pain because this is a hinge point in your mid-back. How long does this shoulder pain last? Now, this is a very good question, but also very hard to answer because it's very individualized. This sort of pain differs from person to person. Some people, if it's just a mild strain, can last a week. Some people who have had bad posture for 20 years, this could last a little bit longer. So keep in mind, it's going to last, a depending amount of time, depending on how long this issue's been. Is it bad to crack your shoulder blades? This is a good question. Unless it's accompanied by pain, cracking your shoulder blades is simply a release of gas and is not a problem, and you can do it as long as there is no pain. Why do my shoulders hurt when I sneeze or cough? Now, when we sneeze or cough, we increase the intra-abdominal pressure, which can put pain on your low back or your mid back If you do have a slipped disc or some other pressure-induced painful area, this is very common, but it is something to get looked at. If you do have this sort of pain, consult your primary care provider. Thank you again for tuning in to Early Bird by Amerisleep. If you did find this content helpful, be sure to leave a comment and check out our other informational resources on the website attached to help you get the best sleep of your life. Until next time, sleep well and take care.